vet panel today consists of Dr. Sarah Hummel from Desert Trails Veterinary Clinic in Winnemucca, Joe Gillespie from Boehringer Ingelheim in McCook, Nebraska, and Lyle Whitaker from Lahontan Valley Veterinary Clinic in Fallon. And so the way that we will operate here this morning is the vet panel. Each member of the vet panel will get 10, 15 minutes or so for their featured topic. Okay, our next speaker, Dr. Gillespie. I'll just turn it over to you. I think I saw, yes, you're up and running. I think they have you just about ready to get into the queue.
Just briefly today, thanks for the opportunity to join you. Like he introduced me, I work for Boehringer Ingelheim, a pharmaceutical company that makes vaccines and therapies for basically all of animal health, but I focus in the cattle industry. I support and help with our sales force in the Western United States, and I practiced for 25 years in Western Nebraska as a beef cattle veterinarian, and for about the last 4 years, I've been doing this. But one of the things when they approached me about sharing something about animal health to the producers in Nevada, I really thought it was important to talk about bovine respiratory disease, or BRD. And we have an approach at Boehringer the last couple of years that I think is worth just visiting about. It's a holistic look at BRD. We think that we give them a shot for this or that, and we're going to prevent disease. And really, it's a holistic approach. And we think about it in three sort of cogs. One is building immunity. Two is mitigating risk. And then three is managing infections when they do happen. Because I don't care how good a producer you are, how specific your program or system is, there's always risk of infection. And so to look at that holistically, we think first of building immunity, and with Dr. Hummel's conversation about dystocias and calving leads me to the probably most critical or most important aspect of a young calf's life. If you think about it, the hardest day of a calf's life is probably the day it's born. It's going from a perfect environment out into the harsh conditions that we have in the Western United States. And it drops out without any protection whatsoever, except for its innate ability to fight off infection from white blood cells. All that it gets ultimately is from the colostrum it gets from that cow. And I think we need to take a lot of consideration of that with our herds, specifically getting that colostrum into them as quickly as possible. We know that has a direct impact on the ability for calves to be healthy and have some protection against any kind of pathogen they may run into for the first 4 to 6 months of their life. So it's very, very important. And I don't have a slide on that, but a calf that fails to get colostrum has actually a 3.5 times greater risk of death before it gets to the slaughter facility at the end of its life. So it's very important. And failure of passive transfer can come in many ways. One, it's not getting the colostrum, but also in the case she just talked about dystocias, if we have calves that are difficult calvings, maybe they don't feed right away, maybe they don't get up right away, maybe they're chilled and absorption of that colostrum is impaired. There's a lot of factors that go into that. So as a producer, I think it's real important that you be prepared for that. One, making sure that it happens. And two, if you have a calf that may be at risk of needing some supplementation, visit with your veterinarian about there's some replacement products on the market that are very good, but specifically what products are worthwhile, what products can I have on hand to give a calf when I need to. Maybe it's that difficult dystocia that she talked about. I need to give that calf some colostrum quickly. What kind of tools can I do to do that? So we think that's one of the most important things. Next is, getting some sort of transition from that colostrum immunity of protection to that calf building his own. And we do most of that through vaccine, and that's called an acquired immunity. We give a vaccine for a particular pathogen. And our hope is that that pathogen or that vaccine causes an immune response, which helps give that calf or animal memory. So if they see that pathogen again, they're protected. Again, we're taking what God gave the cow, past that colostrum, sometime between when the calf is old enough to develop his acquired immunity and that passive immunity or the colostrum is starting to go away. We want to use tools in that at that point to help jumpstart them to get them to the point where they have protection whenever they see a pathogen when they're older. So what we think about particularly is choosing an antibiotic that can stimulate both the local and systemic immunity. And by local, I mean the upper airways, the linings of the nostrils, the upper trachea, those types of areas. It's a local immunity is an IgA antibody that's working on the mucosal surface. It actually works on the gastrointestinal or gut mucosal surface as well. But it's important to understand that we need tools like that. The analogy that I most often make to producers is it's like a berm, right? If we have an area that's protected against flooding by a berm, we need a barrier up front locally to protect. But we also need a barrier behind in case that berm breaks and the water floods into our homestead. We need some sort of tools to help protect there. And that's where the memory or the IgG antibodies take place. That's the systemic. It's circulating deep in the body. So finding products or vaccines that can offer both of those tools to you is a better way of looking at that BRD prevention. The other thing that I always want to talk about to producers is picking the right vaccine at the right time. Visit with your veterinarian. He's your best person to talk about what immunity is, what vaccinations do. Many times we vaccinate at the wrong time, near or after a stress event, and we're asking a calf to mount an immune response where he's under a great deal of stress. That's not always best for the calf. So have conversations. I think Barry made a great point about making a plan when you're doing something. He was talking about dystocia specifically, but I think that we could make a plan with our veterinarian to really bring out the best aspects of how a vaccine program is going to help prevent disease in your herd. Every herd is different. Every situation is different. How can we use those tools together with the resources of my veterinarian to have a low stress, high response to immunization, and maybe a calf that's protected and may stay healthier longer? But what we do know is even though we give vaccinations and we have good colostrum, we can't prevent infection 100% of the time just with that tool. So management practices become essential, which leads to our second cog, which is mitigating risk. Everybody has risk out there. This time of year, it's snow, winter, cold. But what I like to look at is if I protect an animal with vaccine, I'm getting a common word we heard with the COVID situation is herd immunity. I'm getting protection of the whole group. But if I cause too great a stress or I cause too much of a load of a particular pathogen, I can cause disease. And so reducing those risks of the stress and or the pathogen helps us continue to help keep our cattle healthy throughout whatever production system you're operating in. If you're a cow-calf operator, you're running stockers or yearlings, you're operating a feed yard, whatever the situation is, we need to be able to think about risk. What are those risks? Commingling is a risk. Stress is a risk. Shipping is a risk. Having latent disease in my herd. One of the things I know we've talked you guys are talking some about trick and some other things today. BVD is another persistent virus that's in our cattle herd. If you look at it, it's about 0.4% of the U.S. cattle herd. But when you have 90 million animals, that means there's quite a few animals out there that are active carriers of the virus that can cause the onset or stress that can lead to respiratory disease. So thinking about all those things communicating with your veterinarian to have an understanding of where you can best fit your operation with a vaccination program, reduction in stress and stockmanship handling, and maybe even some sort of screening. I thought JJ mentioned earlier about bringing cattle into the area, what impacts that could have. It's real important to think about all of those disease risks as we move forward. Sometimes, even with vaccines, colostrum, good management practices, infections can still happen. So we just want to think about what that means in managing those infections. I know no one on this call today wants to get an upper respiratory infection and not go to the doctor and not get something for them to help overcome that particular pathogen. So we think treatment and early diagnosis is critical to preventing long-term damage. First, if treatment is delayed too long, no antibiotic is going to work. Doesn't matter what you choose, what class. Dr. Hummel talked about one particular class. There are several different classes of antibiotics that you can visit with your veterinarian about specifically that could be used for respiratory disease. But if we wait too long, those antibiotics are not going to repair any permanent damage that's made to the lungs. And I took a slide out today not to present this to you guys, but I'll just mention it at this point. If we think about our cattle have about 20% of the lung capacity as a horse. So if we have an animal that has, and they actually need about 2 times the oxygen that a horse does just to normally function. So we have less capacity and we have a higher need for oxygen to exchange in the lungs. So if we have damage to those lungs at a young age, or even as an older animal, it very seriously compromises that animal's ability to be productive. Whether she's a cow in your herd, is she going to get pregnant every year because she's under the stress of damage to her lungs? If he's a calf, is that calf going to gain at the rate at which his cohorts or his other pen mates are going to gain because of that damage to his lung? We need to assess cattle as frequently as possible. I know here in my slide I say daily. I'm out on the range, that's a little more difficult depending on your situation, but make sure either you or your employees understand how to identify respiratory disease. What does that look like to you? Coughing, loss of appetite, discharge, fever, lethargy, an ear down, whatever it is that you can see to lead you to that calf and lead you to making a diagnosis early will limit the damage and maybe the long-term effects. I just closed in this slide with a little bit about diagnostic testing. What we've seen in the industry is that we have created more and more tests that are available to help us with these things. Nasal swabs is one, blood test, use of ultrasound to actually look at we see that most commonly for pregnancy determination, but we can look between the ribs and look at the lung tissue and see if there's damage. And then finally, if we have some sort of loss, have your veterinarian do some diagnostics looking at necropsy to better understand what potential bacterial pathogens are involved and how can I mitigate that risk next time. It may not have a direct impact on today, but it can have a direct impact on the next case. The other thing when we're using antibiotics, I think is very important, is not to assume. We have great antibiotic tools today, and we have some great long-acting antibiotics. Understand what that antibiotic with your veterinarian, what its interval is for treatment. So if I treat today, how long can I wait before I treat again? Because just treating and treating day in and day out used to be something we did 25 years ago when I started in practice. We put cattle into the hospital, we treated them once a day for 5 days with the same treatment. We have great tools today that can allow us to have an interval between treatments, and that allows a couple of things. One, less stress. If we give an antibiotic that's working effectively over an extended period of time, say a week, we can put that animal back to its home pen with its cohorts or its friends, and we cannot run it in a chute every day, reduce the stress. The antibiotics help the body work more effectively that way. Antibiotics don't cure anything. The animal's innate ability, or its built-in ability to fight off infection, is what ultimately eliminates that infection. What antibiotics do is either prevent the replication or reproduction of bacteria, or they suppress the ability of that bacteria to replicate or grow. And so it's just helping the body help itself. So if we have a product that's there available, make sure we use it effectively so that we get the most long-term effect from it. And the use of an antibiotic every day is maybe not the right particular tool in every case. Some cases that may be. Look to your veterinarian to help build a plan around protection and prevention, and use those tools optimally to help you work with them. So again, as I think about it, it's an effective holistic approach. It's not one tool, one syringe, one needle. It's building immunity, understanding colostral needs, vaccinating and creating protection in an animal's ability to fight off or develop acquired immunity, reducing risk, stress, those factors that can increase the risk of the pathogens causing disease. And then finally, if you do actually have disease happen in your herd, utilize the tools that are available, visiting with your veterinarian to better understand how we can manage that infection. So Barry, I'll stop there and let you go to the next one. We'll have some questions at the end.